Lecture 8, Keeping an Eye on Healthcare Costs, Part 2. The cost variable would be considered as the dependent variable, and we want to predict the cost of healthcare by other independent variables. Okay, so here instead of directly predicting the cost, which in that case we will have a continuous variable. Uh, the cost variable would be a continuous variable. Okay, but instead of doing that, we are going to classify the costs into 5 buckets. So by doing this, actually we are converting a continuous variable to be a categorical variable with 5 outcomes. Okay, and then we will classify the observations, the cases, into these 5 buckets. So by doing this, our problem turns to be a classification problem. Okay, so here we consider 5 buckets, and as you see here, the fifth bucket uh, is the bucket by having the costs over $55,000, as and only 0.5% of the observations belong to this bucket. Or bucket 4, as you see here, we assume that the cost range would be between $19,000 up to $55,000, and only 2.1% of the observations belong to this bucket, and so on. Okay. Now, let's see what would be the medical interpretation of the buckets. After classifying the observations and the cases into the buckets, so how we are going to treat each bucket. The first bucket, bucket number 1 here, has very low cost. So we don't consider any action for bucket 1. For bucket 2 is in the category of emerging to moderate and high cost. And bucket number 3 has moderate cost. So these 2 buckets would be candidate for wellness programs. Okay. And bucket 4 has pretty high cost. Okay, so bucket 4 would be candidate for disease management programs. And the last one, bucket number 5, has very high cost, and this bucket would be candidate for case management. So for bucket 5, each individual would be treated individually. So we'll have intervention programs in order to improve the quality and the cost for each individual patient in bucket 5. Okay. For the error measures, usually when we have a continuous variable, so we are applying regression models, so our square would be our error measure, right? Or when we apply a cart model, we have classification problem, then accuracy would be our measure for error, right? But here in D2 Hawkeye case, failing to classify a high cost patient correctly is much worse than failing to classify a low cost patient correctly. Okay, so because of that, it's better to consider penalty error. So the worst error would have higher penalty. So yeah, here we consider penalty error to capture this asymmetry. The key idea here for having a penalty error is to emphasize on finding the high cost members by penalizing misidentifying them more. Okay, so yeah, so here we can define a penalty matrix as the cost of being wrong. Okay, so in this example here, in this penalty matrix, as you see here, uh, misclassifying the bucket 5 to bucket 1 has the highest penalty weight here, which is 8, compared to, for example, misclassifying bucket 2 to bucket 1, which is 2, or bucket 1 to bucket 2, which is 1. So yeah, here we have an asymmetry matrix, and the worst case is misclassification of a higher bucket to lower bucket, and we usually have higher penalty weight here for those cases. Okay. Before applying a model, we need to have a baseline method, and then we will evaluate the performance of our model with comparing its results with the baseline method. So in this case, in D2 Hawkeye case, we assume that the baseline is to simply predict that the cost in the next period will be the cost in the current period. In our data set, we have the cost bucket for 2009, and we want to predict for 2008, and we want to predict for 2009. Okay, so in baseline method, we assume that in 2009 we will have the same buckets as 2008. So this is our baseline method. So the accuracy of this method is 75%. It's pretty good. So we have a challenge in developing a new model in order to beat this good accuracy, right? And the penalty error here is 0.56. So how we calculate the penalty error here? Here we assume that we have a matrix with the buckets, the bucket allocation, right? 2, 3, 4, and 5. So here we have the numbers, right? The numbers of the observations belonging to each bucket. So here is the actual, the actual bucket, and the columns are our prediction, right? Prediction. For example, the actual buckets would be for 2009, and our prediction would be the buckets in 2008. So then we will have a matrix of like this with the dimension of 5 by 5, and the numbers in the matrix would be the number of cases in that element. The actual and then the prediction. Okay. Then we should multiply this matrix by another matrix, which is the penalty matrix here, which the diagonal members here are 0, right? And the rest we have the penalty values, right? The penalty values. But here, this multiplication is not a matrix multiplication. It's actually a simple multiplication of element by element. So this element would be multiplied by this element, and again this element by this element. So it's just the element by element multiplication, and then we get the sum over all results, and at the end we will have a number, right? We will have a number here which would be the penalty error amount. Okay. Our problem here is the multi-class classification, and you want to apply the CART method for classification. Okay, so here we have an example that how this would work for our data set. In the first split, we are considering the CAD as the coronary artery disease. So if the case is positive, we have the coronary artery disease, we go to the right as the yes option, and the no option will go to the left. So if it's no, then the bucket would be bucket 1. But if it's yes, we have another split here, and it's about the diabetes. So if the diabetes is yes, then the bucket would be bucket 5. If it's no, the bucket would be bucket number 3. Okay, so this is how the splits and classification work here. As you remember in previous lecture 7, we discussed that the most important criteria or factors appear in the top level of the card tree. So here the first split is about is about the cost, but as the most important factor here. So if the cost is less than or equal to $4,000, the bucket would be bucket 1. If it's over 4,000, again another split. If it's less than 40,000 or over 40,000, we have other splits here, and it goes down. Okay, so this is how we have a hierarchy tree here, and we have the splits. Maybe in the lower levels we have other criteria, not just the cost as the splits. In the lower levels, we have the secondary factors like the risk factors. So the split here would be based on the risk factors. For example, the chronic illness. So here, for example, Q146 is the case of asthma plus depression. So if it's 0, we go to this node. If it's 1, then the bucket would be bucket 5. Okay. And another case, for example, Q1 is the risk factor indicating hyaline injection, so or maybe possible knee replacement or arthroscopy. So here the bucket would be bucket number 3 if Q1 equals 1, and if it's 0, then it would be bucket 1. So yeah, as you see here, we could have a very large tree here with many branches and with many splits, and the most important factors, which is about the cost, appear in the top level of in the top of the tree, and in the lower levels we have other factors like the risk factors. Okay, and here we have an example of groups for bucket 5. For example, patients with more than $24,500 in cost in the observation period, and an acute cost profile, and also a diagnosis of cancer. So if we have these 3 conditions, that patient will belong to bucket 5. Or patients in bucket 2 during the observation period. So during the observation period, let's say 2008, for example, it belongs to bucket 2, but with a non-acute cost profile and costs between 2,700 and 6,100 in the last 6 months. So this is the condition, in the last 6 months, and with either CAD or peripheral vascular disease. So again, if we have these conditions, that patient will be classified to be in bucket 5 in the results period. Okay. Here we have the results in comparison between the trees, the card method, and the baseline. So in overall, the accuracy of the trees is 80% and the baseline is 75%. So good. And the penalty error for trees is 0.52 and for baseline is 0.56. So the less here is the better. So, but here we don't see much difference between the baseline and trees. So in overall, we can say it's so-so. I mean, the trees and baseline are working almost the same or no significant difference between these two. But if we go through the buckets, we see the differences. As you see here, for example, for bucket 2, the accuracy of trees is almost the doubles compared to the baseline. See? And if we believe that the most important bucket here is bucket 5, so the accuracy for bucket 5 is 30% in trees, but in baseline is 23%. It's good. But when we go through the penalty error here, we see significant improvement in the penalty error in trees. So here we have 1.01, but for the baseline is 1.88, almost half of it, right? And yeah, as you see here, in all buckets, we have less penalty error. So this shows how the trees or the card model here works better than the baseline method. Okay. So as the insights or conclusion over the trees and baseline method, we see substantial improvement over the baseline, doubled accuracy over baseline in some cases, and although we have a smaller accuracy improvement on bucket 5, but we have much lower penalty here, and this is too important for us. Okay. In D2 Hawkeye case, they also applied clustering algorithms. So when we talk about clustering algorithms, it means organizing the objects in a way that similar objects are in the same cluster, while the similar ones belong to different clusters. So it's all about the similarity. So we group or cluster similar items in the same cluster. Okay, so here in the first level, we can apply clustering algorithm to cluster the patients based on their cost data. So patients with similar cost data can be grouped in same cluster. Okay, and then for each cluster where we have patients with similar cost data, again, we can apply the clustering algorithms to have subclusters based on the medical data. Okay, so this is how it works. And this two-tiered approach actually on the D2 Hawkeye case gave more stronger results than card method. Okay, so yeah, in terms of the accuracy or penalty error, in this case, clustering beated the card method. But the card method has other advantages like being able to interpret the results, right? So yeah, in this case, clustering is working better than card, but we are not going to have clustering algorithm here, and we will cover the clustering in the next lecture, lecture 9. Okay, thank you.